right.
We are live.
All right, welcome to our live stream. This is Dr. Deuk Majin. Our patient is having 2 discs fixed today, L4-5 and L5-S1. We're going to start by getting into the L5-S1 disc. Lay still. He's, you gotta lay still, buddy.
Don't move your arm. Do not move your arms.
If you don't cooperate, we gotta stop the surgery. And then you're gonna come here for nothing. All right? Can you hear me? Yeah. All right? We tried putting you to sleep, but you were thrashing around. So we gotta keep you a little more awake so you can lay still and cooperate. Can't have you moving off the table. Just lay still. Everything's okay. We're going to put you to sleep in a few minutes, all right? AP. All right. So far, you're doing great. Lay still. Our patient has 2 bad discs, L4-5, L5-S1. We're going to go in and fix both of them today. I'm giving you some more numbing medicine. Looking good. Let's go back to a lateral. I'm going to make our first incision, where there's only one incision in his case. The incision is 7 millimeters. It's because this is a minimally invasive procedure. You okay? You're doing great. Shot. So as I place these needles into his bad discs that need to be repaired, why don't you, Sanjay, show the audience why do disc herniations cause so much pain?
Copy that. Playing educational video.
Okay, folks, so when this patient came to me, he had back pain in this area right here. And I looked at his MRI, and he had really 2 disc herniations. There's a 3rd one up higher, but it's not that bad. And it really wasn't where he had the pain. So I figured these 2 are the cause of his pain. You comfortable? Don't move, just talk. All right. Are you having any pain? You having any pain? No. How bad is that on a scale of 1 to 10? 20. Is that where you get your pain? Yeah? All right. Is it better now? Okay. We're going to put you to sleep in just a second. Have you watched any of these surgeries? So you know what's coming next, right? I got to test your other disc. How bad is that? How bad is that on a scale of 1 to 10? 8. All right. Good job. We're going to put you to sleep. Is that where you get your pain? All right. You got to go to sleep. When you wake up, we'll be done. That pain will be gone, all right? I want you to count out loud for me, 1 to 100. And when you wake up, we'll be finished with your surgery. All right, great news. So what we've learned is that the L4-S1 disc, the bottom one, he called it a 20 out of 10 pain. That means that's where most of his back pain's coming from. The L4-5 was an 8 out of 10. You got that?
Yes.
Yeah. You always want to start at 5-1. I want to start. No, I like 4-5. I always go into 5-1, but 4-5 because I like to do 5-1 without another needle there. All right, Sanjay, have you played the video on why do herniated disc cause back pain? Sean?
No, not yet.
Let's play that.
Copy that.
Sean? All right, welcome back. We are entering the L4-5 disc. Shot. You could see us, we're going right into the tear where the herniation came out. And I'm basically going to repair this tear with the laser and remove his herniation at the same time, all using the laser. Is he sleeping? Comfy? That should be good. All right, we are in at L4-5. This was the disc that's giving him 8 out of 10 pain. Did you get a shot? No? Shot? That looks good. So far, we've lost about 20 drops of blood. Not very much. This surgery is pretty much bloodless surgery. Scope on. We're going to go under the scope. Irrigation on. You got it? Thanks. All right. So now you all have seen
Thank you.
you've all seen the video on what we're doing, right? There's his tear right there. That's where his back pain's coming from. You can see the herniated disc, the blue stuff. Now, how old is our patient?
20.
He's young, 20 years old. And he's had this pain for how many years?
A year and a half.
A year and a half. So I was talking to Sanjay earlier. Sanjay asked me, what's the youngest patient you ever did surgery on with this surgery? Huh? Was she 14? I thought she was 15. Oh, the guy. We did it for the guy. You're right. Sanjay, I'm wrong. The youngest was a 14-year-old male from Seattle.
Wow.
Or Washington. Seattle, Washington.
Okay.
Yeah, so we did go younger than the 15. I forgot about that. Yeah, he was actually going paralyzed, and the doctors where he lived kind of blew him off. And he couldn't walk. And he came here, and we basically did the laser surgery on his herniated disc that was causing him to be paralyzed. Huh?
And what about the oldest one?
I didn't understand what you said.
In terms of the
Oh,
age?
the oldest patient was 96.
Okay.
Actually, I did a 4-level fusion. I think the guy was 95 or 94. And he went home the same day. Screws, rods, cages. All right, you can see the tear right there. And that's where the pain's coming from. Now this is L4-S1. If you look at the MRI, it doesn't look too bad. And if you look here, it doesn't look too bad. But we did the discogram. We know it is causing pain. I'm having trouble getting to 12 o'clock.
Better now?
Yeah, a little bit. Yeah. What'd you do different?
I just put you over.
This will be a not too long of one to do. Any questions from our audience?
No comments or questions.
Sanjay, are you sure you're broadcasting?
Yeah, I'm broadcasting. There are 7 viewers on YouTube right now.
Are you on Facebook?
Yeah, I am on Facebook.
And are you making sure you can see us?
Yeah.
So it's very strange to have so few people.
I think it's almost the end of the day.
The suction came off.
Oh, can you go check that?
Come fix it. It's literally pouring on my leg. Come on. Yeah, she needs gloves. You guys are supposed to have gloves on in the operating room. Okay? All times. Whoever put that on, you got to put it on harder. Huh?
Thank you.
Feeling wet, my wet leg. I'm like, what the fuck?
It's a present for your anniversary.
Anniversary present. Thank you. You guys are awesome. I see what you want me to do. You want me to get my pants off. My wife's not even here. Holy moly. It's just still dripping from before. Okay, folks, so take a look at this. It's really good. The glass fiber is 1 millimeter, and you can see the defect in the annulus is 1 millimeter, basically. Just big enough to fit the glass fiber. We're almost done here. This is the L4-S1. Just about done. All right. What is that? I must have gotten some water. Nope. Let's just take a look. Yeah. I don't see anything more. That's it. All right, we're done here.
2 hours, please. Come on. Thank you.
Sometimes they go quick, sometimes they go slow. We'll use a little betadine to do some irrigation. Betadine is wonderful stuff developed by NASA to fight any kind of bacteria or infection. Let me have it back. Oh, it's clear. All right, any questions?
No questions.
There's something wrong with that broadcast.
Uh,
We always have people here asking questions. Are you sure you're
Yeah.
broadcasting on all
I-
the platforms?
I just verified that. Everything's working fine.
Independent verification?
Yes.
I'm gonna check my Facebook. Right?
You can tell? No.
Yeah, I have it.
It's broadcasting? You see it? That's us right now. Look at that. All right. Maybe Facebook's upset with us. They're not showing it to too many people.
Maybe that's the issue.
Maybe. They want me to pay more money. Paying us money so we'll show it to people. Come on, Jordan, I'm waiting for you. Jordan, you're killing me. Jordan! X-ray, there we go. Is everything okay, guys? Shot? Anything I need to know? Sure. All right. Very good. You do? All right. Here we go. Thank you all for verifying. Shot. We're going to head down to the more painful disc, the 20 out of 10. This one is definitely going to be a more painful one for him. Shot. The tear is bigger down here as well, I think. Shot. Shot. All right. You gave a lot of num-num, Dr. B. Shot. Shot. Yeah. It's looking good. I feel the herniation. Shot. Shot. Take. Take, take. All right. So that should be good. Yeah, it went in. You see that? It went in pretty easy. Big tear. Big tear here. This was the 20 out of 10, right?
Yes.
Feels a little tight. All right. Let's take that and see what we got. All right, any questions from our audience?
No questions.
Give me a Raytech wet. Oh yeah, it's twisting everything. Shot. God damn it.
Can you bring the vice grip stop?
No, we don't need a vice grip. The vice grip is when it gets stuck in the disc. What I need is something to hold this with. Trying to free up the dilator from the tube. Let me have the mallet. Shot. There's a little bit of, that should have done it. A little bit of disc material stuck between the tube and the dilator. Shot. Uh-huh. We may have to put in a little more. Okay, shot. Yeah, it's close. Let's go back in. Mm-hmm. Shot. Shot. Mm-hmm. Shot. All right, should be it. Shot. Looks good, perfect. Okay, let's get the scope out. Drug disposal. Huh.
What happened?
I was just looking at that container.
Oh, that's the medication.
I didn't know they had such a thing. Oh yeah, look at all that inflammatory tissue. Whoa, whoa, whoa. That's pretty cool, Sanjay. Look at that.
Yes.
That's why this disc is a 20. Look at all the red,
I
the
can see that.
inflammation. Incredible. Incredible. You know, that's kind of a good one for the website.
Okay.
Just let me see. Give me a second. I'm going to try to sharpen it up. That's getting worse.
Yes.
Maybe. Try a picture of that.
Okay.
Yes? Laser. Did you get it?
Yes, I'm taking a picture of that. Just a minute.
Did you already get it?
No, not yet.
Well, just save it. Save it. You know where it is. It's here.
Yes, I got that.
All right. Grab her. When we talk about the inflammation inside the disc, you can actually see it in some patients. We saw it earlier today in that lady we did, the 3-level,
Yes.
and now we see it in the young man as well. I'm trying to get to 12 o'clock. It's just not going. There we go. It's a little better. You guys doing all right over there? Dr. B, we got 10 minutes. Best as I can tell. I'm having trouble now with that. It's too much. I think you're pushing too much. Cannot move this thing around. It's not rotating. Here we go. I don't know why this fiber is just not going where I need it to go. Let me try to manipulate it. This is the this is a 1 millimeter, right? Is our last lady gone?
Yes, I just did sugar.
Uh-huh. Great, thank you. If I break this fiber in my finger, it's gonna hurt like hell. Can already tell. You know, I broke the 1/2 millimeter fiber once, right into my finger. Did you know that?
Yeah, I hear when you mentioned that.
It almost shot right through my whole finger. It was on a I think it was a lumbar case. Put a hole. You can still see the scar. 17 years later. Damn it. The blue towel has to go in the bag. Otherwise the water will go over it. grabber. Yeah, this disc is definitely more damaged than the last one. A lot more herniation to deal with. More scar tissue. We talked about how common it is for people to have these discs that are damaged in the lower back. We know that L4-5 is the most common to be symptomatic, but in this case of this gentleman, the L5-S1 is definitely more symptomatic. So in a way he's keeping with sort of the status quo where 4-5 and 5-1, that's what he has his problem at, but sort of 5-1 is the more painful one. More of that inflammatory tissue we see so much of. I cannot get it to 12 o'clock. I don't know why. Maybe you're pushing too hard. Pull it back towards you a little bit. Yeah, that's actually better, yeah.
You have 5 minutes?
5 minutes. Yep. Look at all that angry tissue, all the inflammation there. Sanjay, you see
Yes,
it?
I
That's
can see
another
that.
good one right there.
Yes, let me take a
Save
snap
that
of
one.
that. Yes.
I'm going to shut off the irrigation for a second. That's textbook perfect. Get it real quick, or just remember it and snip it later, okay? But this is good for the annular tear. Look at all that inflammation in the annular tear.
Yes, doctor.
That's one of the best I've ever seen. So make sure you save that section.
Yes,
Find out
doctor.
what the time point is and have you or Henry snip it, okay? And I
took
want that picture. Take
Yes,
a
doctor.
couple of them.
Yes, doctor. I've taken that.
But you could see that the inflammation is in the white part, which is the annular tear on the side of the herniation. The blue stuff is the actual herniation.
Copy that.
So the annular tear is there, the herniation is there. And I'm cleaning both. This is the annular debridement. Incredible. Good stuff. It's always nice to see that. It's always nice to get a discogram that's so positive, you know, so evocative and provocative for pain. It's also nice to see so much inflammatory tissue and to get rid of it all. Any questions?
No questions.
Yeah, there's definitely something wrong. Hey, Berndes, can you ask him a question on Facebook, please? Let's see if there's something wrong with her. I don't think we've had a surgery so quiet in a long time. It's not even that late.
Okay. We have a question from Tom on YouTube.
Uh-huh.
Hi. I have neurogenic intermittent cloudy catin. Nothing jumping out in MRI. What next?
Neurogenic claudication?
Yes.
I need to see his MRI. Do the MRI review. I don't know why you would say nothing's jumping out, but I wouldn't trust the radiologist who misses that. Radiologists miss this stuff all the time. You can't trust all the radiologists. You need an expert's review. Man, this stuff is so tough. He's 20 years old, right? And yet this herniation has amassed a lot of scar tissue in the time that he's had it. I don't think the herniation happened a year and a half ago. I think this herniation must have happened before that. Because this scar tissue here is far older than 1 year. Were you successful at asking a question?
Yes, Sanjay received my question.
What? Okay, do you see another question?
Yes, I just replied to that.
Huh?
I just replied to that.
I could not understand a word he said.
I just replied to that.
Oh. Well, is it X-rated or are we allowed to say it?
It says I have a question.
Oh. All right. All right.
You're live as live can be.
All right. All right. Maybe on October 12th there's just not that much interest. Well, there's the end of the inflammation right there. Incredible. I've never seen so much inflammation, but that explains a 20 out of 10 pain, right? That we all saw.
We have a question from Premier Media Group on YouTube.
Premier Media Group, huh? What's that? Change it. Yeah, go ahead, Premier Media Group. Probably 3 minutes.
Sanjay, did you see my question? I wrote, I have a question.
Yes, I did.
Perfect.
So Facebook is working,
Yes, it is.
and YouTube is working.
I would agree with
Yes.
All right.
So we have a question from Premier Media Group on YouTube.
Yeah.
What is patient's career? Is there a connection between herniation and the job duties or hobbies maybe?
He said he heard in the gym and he's a baseball player in college.
Yeah, there's no connection. I can't tell you their career, but I can tell you they're on their way to being a professional baseball player. And I think he hurt himself either playing baseball or in the gym. But, yeah. Basically, once he heals up from this, you'll see him playing pro baseball in the future.
We have a question from JMC on YouTube.
Yes, JMC.
Any thoughts on SI joint pain?
Yes, yes. There's we have a treatment for SI joint pain that's curative. It's called Deuk plasma rhizotomy. It takes literally 15 minutes to do, and it's outpatient. You have immediate recovery, and the pain usually goes away immediately. It's a wonderful treatment. It does not involve any fusion or metal, and I would recommend it for anybody with SI joint pain that's chronic. We've done probably, how many SIs have we done, Luis? With Patel? 20, 30?
Probably
About,
about there, 25.
yeah, 25 to 30 in the last year. And patients do very well. The more inflammation they have in the SI joint, the longer it takes for that pain to go away, but most people it goes away right away. All right, got 1 minute left. This disc was definitely a lot worse than the last one. Great questions. All right, that should be the end of it right there. It's very firm. You know? I'm not able to get to where I need to go. Very firm. Just underneath the posterior ligament, sort of at the end of the herniation. This should really be good. I feel good about it. Let me just do a grab with the grabber. Make sure we're not missing anything. You doing good, Berndes? All right. Just little pieces, nothing real substantial. What? What do you want me to say? Hey, you. Huh?
Take it.
Take it.
Oh, yeah.
Take it.
I know.
That's all right. I've come to accept my toes will be wet. All right. Now, where is he from? Bureau. Excellent. All right, I'm just about done here. It's just want to make sure we get this all done. So much scar tissue. This is definitely an older injury than a year and a half. This is at least 5 years old. At least. You know how kids are, right? They do all kinds of things they're not supposed to do. Huh? I don't think it's lifting weights. I think it's more, I don't know. I'm sure he did something. Maybe he doesn't even remember it. But his pain may have started a year and a half ago, but that's because the tear was already there. You know? There's no way this amount of scar tissue you never see with something that young. Never. All right, Berndes, I really do have 30 seconds left.
Sitting down, please. Thank you.
Scope off. Scope use was a 7.
You hear that, please?
7 on the scope.
All right.
Why is the suction off? Who put the suctions on today? Can we make sure the suctions are put on properly?
This suction over here.
That one came off, this one came off. I mean,
You did this?
I already did it. I need the roly. All right, Sanjay, any questions?
No further questions.
All right, so check it out.
Thank you.
There's the whole incision right there.
Yes.
Incredible.
Yes, we can see that.
I'm going to hold a little bit of pressure for a minute. And then we're going to close it up, put a bandage. He's going to go home in an hour. And we'll see him back in the morning. I feel good. I feel like we've got his pain source down, nailed down, fixed. You ready? Thank you, everybody. Great work. Sanjay, if there's no questions, you can end the broadcast.
Copy that.